Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is neurovascular supply of the pharynx. Free medical education, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Arterial supply of the pharynx. Arteries of the pharynx are terminal branches of the external carotid artery. They are, number 1, ascending pharyngeal from external carotid artery. Number 2, ascending palatine branch through facial artery. Number 3, greater palatine branch through maxillary artery. And number 4, lingual artery from the external carotid artery. Venous drainage of the pharynx. Veins of the pharynx drain into the pharyngeal plexus of veins, which together with the pharyngeal plexus of nerves, located on the outer surface of the constrictor muscles, especially on the middle constrictor. 1 or 2 veins from the venous plexus pass outside between the internal and external carotid arteries. They drain into the internal jugular vein, which is located opposite to the angle of the jaw. The pharyngeal plexus of vein has connection with pterygoid plexus of vein and the cavernous sinus. Nerve supply of the pharynx. This is part of the brainstem. This is medulla oblongata. This is the pons. We are going to talk about nucleus ambiguous. This is the nucleus ambiguous. Nucleus ambiguous is a group of motonuclei of 9th, 10th, and 11th cranial nerves, where you can see motonucleus of 9th, 10th, and 11th cranial nerve nuclei in the nucleus ambiguous. It is located along the length of the medulla. The nerve fibers from the nucleus ambiguous supply the muscles developed from the 3rd, 4th, and 6th branchial arches. Pharyngeal plexus. Pharyngeal nerve plexus is located on the posterolateral aspect of the pharynx over the middle constrictors, deep to the buccopharyngeal fascia. The pharyngeal nerve plexus is made up of pharyngeal nerve fibers of glossopharyngeal, that is 9th cranial nerve, cranial accessory, that is 11th cranial nerve, which is coming along the vagus nerve, and branches from the superior cervical sympathetic ganglion. We are showing 3 diagrams, A, B, and C. Each diagram we have part of the brain stems and medulla showing the nucleus ambiguous. In diagram A, diagram B, and diagram C. And each diagram we are showing pharyngeal muscles. These 3 are constrictor muscles, superior constrictor, middle constrictor, and inferior constrictor. Inferior constrictor muscle consists of 2 parts. The upper part, which comes from the thyroid cartilage, is called thyropharyngeus muscles. The lower part, which arises from the cricoid cartilage, is called cricopharyngeus muscles. On the posterolateral part of the middle constrictor, we have pharyngeal nerve plexus. Here we have 3 longitudinal muscles are there. The one coming from the styloid process is called stylopharyngeus. The one coming from the auditory tube is called salpingopharyngeus. Another one coming from the palate is called palatopharyngeus muscles. Now we are going to talk in diagram B. This is sympathetic change. You can see in all three diagrams. In diagram B, the nerve fibers coming from the glossopharyngeal nerve, that is the 9th cranial nerve, comes out. One go to the pharyngeal nerve plexus on the middle constrictor. Another branch will go and supply the stylopharyngeus muscles. Sympathetic chain also gives sympathetic fibers to the pharyngeal nerve plexus on the middle constrictor muscles. In the diagram C, we have accessory nucleus, that is 11th cranial nerve, at the lower part of the nucleus ambiguous. This nerve comes out and gives branch to the pharyngeal plexus and supply to the superior constrictor, to the middle constrictor, to the inferior constrictor, both parts of the inferior constrictor, thyropharyngeus and cricopharyngeus parts, and also to two remaining longitudinal muscles, that is salpingopharyngeus and palatopharyngeus muscles. In addition to this, 11th cranial nerve gives additional two branches called superior laryngeal branch and recurrent laryngeal branch, which supply to the cricopharyngeal parts. So cricopharyngeal part receives three branches, one coming directly from the 11th cranial nerve, and another two, one coming through the superior laryngeal branch, another one recurrent laryngeal branch, both also coming from the 11th cranial nerve. So if you see very carefully, all the muscles are supplied by the 11th cranial nerve except stylopharyngeus nerve. Stylopharyngeus muscle is supplied by the glossopharyngeal nerve. This is the very diagrammatic pictures of the nerve supply of the pharyngeal muscles. As you know, this very big nucleus ambiguous along the medulla consists of three nuclei. This is glossopharyngeal nerve nucleus, that is the 9th cranial nerve nucleus. This is vagus nerve nucleus, that is the 10th cranial nerve nucleus. This is cranial accessory nucleus, that is the 11th cranial nerve nucleus. Now we are going to show the muscles of the pharynx. We have three longitudinal muscles. This is stylopharyngeus coming from the styloid process, palatopharyngeus coming from the palate, and salpingopharyngeus coming from the auditory tube. And we have three circular, that is constrictor muscle. This is superior constrictor, this is middle constrictor, and these two are inferior constrictor. It has two parts. The upper thyropharyngeus part arises from the thyroid cartilage. This lower part, cricopharyngeus part, arises from the cricoid cartilage. This is sympathetic change. This is middle constrictor. As I mentioned earlier, On the posterolateral surface of the middle constrictor, we have pharyngeal nerve plexus is present. It is formed by fibers coming from glossopharyngeal nerve, fibers coming from the accessory nerve, and fibers coming from the sympathetic chain. So, our pharyngeal nerve plexus is formed by three types of nerve fibers coming from 9th, coming from 11th, and coming from the sympathetic chain. Now, nerve supply of the muscles. This is stylopharyngeus muscle, which developed from the third pharyngeal arch. So it is supplied by nerve of third pharyngeal arch, that is glossopharyngeal nerve. This is 9th cranial nerve. So stylopharyngeus muscle is supplied by glossopharyngeal nerve. Now we are going to talk about other muscles, two more longitudinal muscles, palatopharyngeus and salpingopharyngeus, and circular, that is constrictor muscle, superior constrictor, middle constrictor, two parts of inferior constrictor muscles. If you see very carefully the purple color, this is accessory, that is 11th cranial nerve comes here and participate in formation of the plexus and supply these nerve fibers, 11 fibers supply all the muscle, palatopharyngeus, salpingopharyngeus, superior constrictor, middle constrictor, and both parts, thyropharyngeal part and cricopharyngeal part of the inferior constrictor. That means 11th cranial nerve supply all the muscles except stylopharyngeus, which is supplied by 9th cranial nerve. In addition to the nerve supplied to the cricopharyngeal part coming from the 11th cranial nerve, this part receives another two more branches. One is superior laryngeal nerve, another one is recurrent laryngeal nerve. They also come from the 11th cranial nerve, coming down along the vagus nerve and supply this small part, cricopharyngeal part. So cricopharyngeal part is supplied by three branches. One, 11th cranial. Number two, superior laryngeal. Number three, recurrent laryngeal. All three will supply the cricopharyngeal part. In summary, all these pharyngeal muscles, both right and left sides, altogether 6 pairs, are supplied by branches from the 11th cranial nerve, cranial accessory, except stylopharyngeus, which is supplied by 9th cranial nerve, because this one developed from 3rd pharyngeal arch and thus supplied by the nerve of the 3rd pharyngeal arch, that is glossopharyngeal 9th cranial nerve. Motor nerve supply of the pharyngeal muscles. Continuation. Stylopharyngeus muscle, one of the three longitudinal pharyngeal muscles, is supplied by glossopharyngeal, that is 9th cranial nerve. Muscle developed from the 3rd pharyngeal arch and supplied by the nerve of the 3rd arch. Main motor nerve supply of the muscles of the pharynx is cranial accessory, that is 11th cranial nerve fibers through the pharyngeal nerve plexus. 11th cranial nerve fibers supply the palatopharyngeus and salpingopharyngeus muscles, that is two longitudinal muscles, and superior, middle, and inferior constrictor muscles. Some cranial accessory, that is 11th cranial nerve fibers, as external laryngeal nerve, nerve of the 4th pharyngeal arch, and the recurrent laryngeal nerve, nerve of the 6th pharyngeal arch, also supply the cricopharyngeal part of the inferior constrictor muscle, RJ last. Therefore, cricopharyngeal part receives cranial accessory nerve fibers coming through 3 branches. Sensory nerve supply of the pharynx. Let's look at the diagram. Pharynx consists of 3 parts. The uppermost, that is epipharynx, is also called nasopharynx because it is behind the nasal cavity. The second part is oral pharynx, behind the oral cavity. And the third part, the lowest part, is laryngopharynx, opposite to the opening of the larynx, also called hypopharynx. Now, what are the sensory supply of each part? Nasopharynx is supplied by pharyngeal branch of pterygopalatine ganglion. The fibers are carried by maxillary division, that is the second division of the trigeminal nerve. Second part, oral pharynx, is supplied by glossopharyngeal nerve, that is the 9th cranial nerve. And the third part, laryngopharynx, is supplied by the internal laryngeal nerve, which is the branch of superior laryngeal nerve, which is actually coming from the 11th cranial nerve, coming together with the vagus nerve. The end. Anatomy DAHAR series, free medical education, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.